Before the deviated nasal septum, understand what is the nasal septum. The nasal septum is the wall of cartilage and bone that divides the nasal cavity into two nostrils. Structure of the nasal septum. Nasal septum composed of two main parts. 1. Cartilage, anterior portion. 2. Bone, posterior portion. Lined by a mucous membrane, which helps in humidifying and filtering the air we breathe. Function of nasal septum. Ensures proper airflow through both nostrils. Supports the nose and contributes to its shape. Helps with efficient drainage of sinuses. What is a deviated nasal septum? DNS occurs when the nasal septum is displaced to one side, making one nasal passage smaller than the other. Severity. Mild DNS may cause no symptoms. Severe DNS can lead to significant nasal obstruction and other complications. Types of deviated nasal septum. 1. C-shaped deviation. The septum curves to one side, causing partial obstruction of one nostril. 2. S-shaped deviation. The septum curves on both sides, leading to bilateral nasal obstruction. 3. Spur deviation. A bony outgrowth or projection on the septum that may irritate the nasal mucosa. 4. Thickened septum. The septum is abnormally thick, contributing to airflow obstruction. Causes of deviated nasal septum. 1. Congenital causes. Present at birth due to developmental abnormalities during fetal growth. 2. Trauma. Most common cause in adults. May result from sports injuries, accidents, physical altercations, minor trauma during childbirth, in newborns. 3. Infections or inflammation. Chronic sinus infections or allergic rhinitis may lead to DNS over time. 4. Surgical complications. Previous nasal surgeries, if improperly performed, can cause septal deviation. Symptoms of deviated nasal septum. 1. Nasal congestion. Persistent blockage, usually more severe on one side. 2. Difficulty breathing. Especially noticeable during exercise or when lying down. 3. Frequent nosebleeds. Caused by dryness and irritation of the nasal lining. 4. Snoring or sleep apnea. Resulting from restricted airflow during sleep. 5. Facial pain or headaches. Due to pressure buildup in the sinuses. 6. Postnasal drip. Excess mucus dripping down the throat. 7. Recurrent sinus infections. Caused by impaired drainage of the sinuses. Complications of untreated DNS. 1. Chronic sinusitis. Inflammation of the sinuses due to poor drainage. 2. Frequent respiratory infections. Impaired nasal function increases the risk of infections. 3. Obstructive sleep apnea, OSA. Serious sleep disorder due to disrupted breathing patterns. 4. Nasal polyps. Growth of soft, painless nodules in the nasal passages due to chronic inflammation. Diagnosis of DNS. 1. Patient history. Ask about symptoms like nasal obstruction, snoring, or recurrent infections. Inquire about any history of trauma or previous nasal surgeries. 2. Physical examination. Use a nasal speculum and light to inspect the nasal cavity. Look for deviations, obstructions, or swelling. 3. Imaging studies. X-rays, CT scans, or MRI may be used to confirm the diagnosis and assess the severity of the deviation.